If you do jiu-jitsu long enough, chances are you're gonna have finger pain. So I'm gonna teach you exactly how you can treat it yourself so that you don't need to take time off the mats and you don't need to spend a ton of money at doctor's office. Guys, I'm Dr. Josh Jagoda, sports chiropractor and jiu-jitsu black belt, and today I'm going to show you how I can treat or how you can treat your own hand pain. Because if you do jiu-jitsu long enough or you play around in the gi, especially in the gi, you are going to likely have finger pain. And I can tell you from my personal as well as professional experience, you see a lot more jiu-jitsu and finger pain with the gi. So if you're somebody who loves the gi just like I do, you are going to likely feel it in your fingers, and we're going to talk about what it is and how you can go about treating it once and for all. So when it comes to finger pain in jiu-jitsu, chances are you're going to likely see a few different things, and you can actually see your hands likely becoming crooked, disfigured, deformed a little bit. You can see little bumps or ridges, and you'll notice that certain fingers are not the same exact size, and that could be due to irritation. That could be due to thickening of the capsule. It can be due to excess bone being laid down. And you can even see these bumps or ridges that occur at the top. And what is that normally? This normally occurs because what happens over time from all the grasping and the ripping and the squeezing is a lot of repetitive strain. And that could be damages to the capsule, to the bone. But over time, what's going to happen is it's actually going to strengthen your fingers, and that's why you see after 10, 15, 20 years, you'll see a lot of disfigurement within that hand. And that's going to likely be because of all the strain and the chronic stress that occurs on the hand. That being said, this is normally painful during the acute stages. So if you're watching this, chances are you may have grabbed too hard, maybe somebody ripped the grip too hard, maybe you fell or twisted your finger, or maybe you got it caught up in a gi. Either way, this is going to likely be an issue. And right now, if you're trying to train hard, you may have to do a few things. One, treat your own finger pain. You may even have to stop gripping. You may have to slow up your jiu-jitsu. You may have to train no gi. But either way, there are ways around it, and I'm going to show you how you can actually treat it on your own, because the truth is you're not going to stop the repetitive strain injury and you're not going to stop the potential disfigurement, but you can slow down the pain and you can get back to training a little bit faster. Okay, so let's show you how to treat it. So one of my favorite ways of treating hand pain or finger pain, and again, this particularly happens within the finger joints, like right here, so you can also feel it at the tips. Most of the time you'll feel it through the actual joint itself. So one of my favorite ways to treat it is with Graston tools, and you can buy some of these types of tools on Amazon or any other place, but this is going to be a really easy way to help out. It's also really important to notice that a lot of these hand muscles not only attach and arise in the hand and down into the hand itself, but also they cross the wrist and they go up into the forearm, as well as crossing the elbow at the common flexor tendon. So it's also going to be really important that if you really want to maximize your recovery, that you potentially work your arm, your forearm, your hand, and all this entire string of tissues here. So we're not going to show everything, but we are going to show you how we use the Graston tools to help you with your hand pain. So assuming you just hurt your fingers, you're probably wondering, how hard should I be going when I use these types of tools? I like to use this little tool. They call it the bottle opener. But what we'll do is we'll grab a little bit of oil, and you don't need a lot or emollient or any type of lubrication to help you out here. And what we'll do is we'll kind of go into this situation where we're kind of scrubbing back and forth. You could do it with the finger straight. You could do it with the finger bent. You could do it in all these other aspects on the top, but what you really want to do is try to encompass not just up and down, so you can see that I'm going up and down, but you also want to scrape towards you and slightly on different angles a little bit as well, making sure that you really take care of the entire joint, front, back, up and down. And there's going to be a little bit of tenderness within here, so you got to really remember that. And because this is potentially a new injury or an irritated injury, you may also need to realize that this is not just going to be a one-time or two-time thing. You may need to treat this 2, 3, 4 times throughout the week. And also, a big thing here, most people go way too hard. It's better to go very light and be using the weight of the tool or a small little pressure, and to be able to not have soreness the next day. So what you really want to do is just not only work that joint that's really injured, but you also want to work above that joint, on the back side of that joint, down in there, and use this bottle opener, so to speak, and to do other joints. While you're here, I mean, you already have the tissues and the lubrication out. You also have the tool out. You're ready to go. You might as well work all the hands and all the fingers here. So let's go ahead and show you kind of just a little bit what that looks like here. So I feel a lot more tenderness here, and I'm just treating this direction. Each tool, by the way, has a little bit of a beveled edge. You typically want to angle that tool roughly about 45 degrees, and so that you're not going too hard going straight down on it, and too far like this where you're kind of like flat on the tool and it's not really doing anything. So there is a treatment bevel side, and sometimes I'll do some scooping, as you can see. So this is the finger that's a little bit more irritated on this side. Again, been doing a lot of gi. I've done no gi in roughly maybe 2 or 3 months, so it's been pretty awesome getting a lot of gi in. But one of those things that you're gonna likely have to change, or I'm gonna have to likely change, is slowing up my gi, right? I'm gonna have to go to some no gi classes, and if I do to go to the gi classes, I'm gonna have to be willing to either get past or not use my grip. While I'm here, it's also really important to note, a lot of people will ask me, hey, what else can I do so that I can help my fingers heal? Should I use ice? Should I use heat? Now, everybody's different, but I will tell you what I have noticed, that usually the heat helps to soothe and make a little bit more comfort within the joints. So I would say things maybe like paraffin baths. I would say things maybe more like, you know, Epsom salt with some warm water. That really is helpful. I tend to use the ice, or I will use some ice cubes on top of the actual finger joints, or I will put my hands inside cold water, usually after training. So while we're going around and treating every single finger here, because why not, you know, if we're already out here, surprisingly, my little finger, or my 5th digit here, is actually a little bit more tender than I would have expected, because I didn't feel any discomfort there, and now it's actually pretty sore. So there is some extra pain and discomfort that I'm noticing on this one, so that's something kind of unique. What I also like about this is that I have found that most of the time, and this is actually kind of an interesting correlation, is that my hand pain has been more discomforting, and I tend to find that it gets more injured usually in the winter, so when my hands are already kind of cold. So I don't know if that's just a coincidence, or maybe I'm just training harder in the winter. I don't know, maybe I'm training more gi in the winter, but I have noticed that when I have my hands exposed to cold while I'm undergoing this type of injury, it doesn't feel as good. So just food for thought if you are somebody dealing with some hand pain, trying to maybe keep it in a optimal temperature, or maybe having gloves if you're somewhere where it's actually a little bit cold. So if you just noticed, I just finished all the fingers. It should take you a few minutes. It shouldn't take you more than 5 minutes. Maybe you're taking 5 minutes if you take a long time. But what you can now do is, instead of just cleaning up right away and maybe going to the other side, let's work into the forearm as well. It's really hard to treat the actual hand itself, so you may need a professional to go ahead and do that for you. I find that working the actual hand is really beneficial, and actually it's probably the most beneficial in my opinion, because a lot of these muscles and tendons go up into there, and it's just hard to stretch on your own. So for that reason, I'm not going to show it, because it's really not as effective as having somebody else. However, you can always add a little bit of extension to get a little bit of a pull through here. Remember, sometimes we don't want to pull out to the side like this at this point in time. We may just want to go straight back because of the irritation to the tendons and to the joint itself. So this is kind of what it would look like if we were to stretch the entire tendon all the way through and make it feel a little bit better. So I mentioned earlier that a lot of the muscles, especially the flexor digitorum, superficialis, and profundus, basically a bunch of different muscles, they not only go down and into the hand and become some of the tendons. So it's going to be really important that we maybe go into this relaxed state and scrape towards us. We'll scrape away. And this is gonna just give us a lot of forearm relief and arm relief. I like to just take care of it all. So you might as well do it in this. I like to do it in this position where we're flexed and relaxed. So if you can kind of see, I'm putting some slack here. Sometimes we may want to put a pillow or something under here, and then I'll put it in this direction. I will also go down and do it this direction as well. I'll slightly hit some angles. I might flex or extend my wrist at some times as well. And then maybe, depending on how I feel, and my hands are a little bit oily, I might add a little bit of wrist extension, and I might scrape it just like this. And again, I will also work a little bit of that bicep. Remember, there's a lot of pulling that occurs here in Jiu-Jitsu and a lot of compression, and we all know what it's like to have our forearms burn out within the Jiu-Jitsu realm, especially if we're trying to choke somebody or, you know, hold on to that grip. And man, this is actually feeling really therapeutic. So I can tell you just from this angle, like here, you can really feel that tissue. It's not painful, but it's just really therapeutic there. So you may want to stay on a certain area for a little bit longer, but this is how I would go ahead and treat some of that type of situation if I'm doing it on my own. And I'm getting a nice little stretch of the tendons in the wrist and forearm. Just remember that you're not doing it too much. Again, less is more. Always be able to come back, right? We think about jiu-jitsu, right? We call it live to die another day, right? So you want to tap out so that you avoid catastrophic injury so that you can continue to train. Well, the same thing is true here when it comes to the rehab sense. You want to be able to do as much as you can possibly without having any symptoms that are negative for the following day or two, so that you can do more treatment cycles through a week, therefore getting more treatment done in a week, therefore recovering faster. So recovery is also determined by how much damage you do or don't do when you're doing your scraping or rehab. This is also what it's like. I'm going to show you what it's like to treat on the other side. In addition to treatment within your hands and your fingers, it's really also a nice thing to make sure that you have gloves around, because sometimes just having gloves is, one, a little bit more sanitary. It's easier to grab the tool because you have a little bit of that latex or that nitrile, and it really makes sure that, you know, you are in a better position to optimally recover. Now, I understand you don't necessarily need it, but it may be a nice thing to have. I have just found that when I treat patients, it's just easier to deal with. Also, less cleanup, right? So you don't see that stuff happening on your tables or anything like that. Sometimes it's just easier to have it. But again, I have the office where I can go ahead and, quote, make a mess, and it's not really an issue because it's something I'm prepared for every day. But maybe in somebody's house, it might be a little bit difficult. So remember, these joints flex, they bend, they kind of add a little bit of torsion side to side. So you don't necessarily need to go ahead and stretch things at extremes here, right? We're just trying to get some therapy in and see what your response to care is. But I can tell you, my right hand is significantly more tender and uncomfortable than the left one, and you're going to notice that some areas are going to be a little bit easier to treat, some are going to be harder, some are going to recover faster, and some are going to recover a bit slower. So it's up to you to kind of decide what you need to do and how you go ahead and treat it. But remember, treating needs to accompany some sort of potential strengthening afterwards, maybe at the beginning while you're undergoing this type of pain or discomfort, which is kind of like a newer injury. It may be hard to go ahead and strengthen. So do what you can. We have a whole bunch of videos on grip strengthening, and I would highly recommend you go ahead and check those out, because those are going to tell you what to do once the pain is starting to go away, so that you can prevent these types of injuries from potentially happening. Of course, one of those ways is letting go of grips. I am not a fan of being a stubborn grip holder. The art of jiu-jitsu is also knowing when to grab and when to let go. That is part of the hard lessons, and sometimes you have a choke in there and you're ready to go and the person's not tapping, but it's just worth letting go because of the pain or discomfort you may have or not have on your own fingers and hand. I'm going to go back into what it's looking like on the forearm here. Wrist flexion here, wrist extension, and I like to put it in a slack position at first. There's so many different ways you can do this. You can do this with you can tie a band to your hand and wrist and do it like this. You could just do it like this. I really like this position because I get a nice little stretch through the hands and forearm. I'll also work that bicep brachialis and elbow flexor right here. Really nice, comfortable. So you may need a tool. You're probably going to likely need a tool. You don't always need to do one, but you know, I like to have 1 or 2 tools that have a capability of basically attacking or treating a lot of different areas of the body. And you could even use a big thick tool like this, same thing on here, but as you can tell, like this one is a lot more fitting for the job. So you know, you just got to realize that sometimes money is going to get into the way of treatment or not treatment. So just having the right tool for the job might actually make the difference, and it might be worth the investment. It may not. You may want to even go in on a buddy who has it, and you guys share products and stuff like that. But things nowadays are relatively inexpensive. You don't need to go out and buy one of these expensive Graston sets, although you're more than welcome to check them out. However, you know, it may not be worth spending a couple grand on these if you're just gonna, you know, use them for a few times. So it might even be worth something else. So again, getting up the right tool is going to be really important. So this is how I would go about treating or self-treating with an acute finger or wrist injury or hand injury. Again, there's something that we did not cover, is actually how to treat the hand itself. However, that is really done very, very well when you have the right provider or practitioner. So make sure that you are getting the right treatment, guys. So I really appreciate you checking out this episode, watching me, and checking out how to treat this once and for all, because this is not if you get injured, it's when. And so how can you do it? Again, you can do anything you want, but again, the deformities that you see and the thickening of the hands and the capsules just as a result of a lot of stress that happens from the grabbing and the gripping of the gi. It's your job to get over this injury as fast as you can so that you can get back to training as fast as you can as well. So see you guys. Thanks again for stopping by. I'll see you on the mat. Us.